Okay, this is a quick ATI Pharm study guide. So ranitidine, hepatotoxicity, and jaundice. Fluticasone inhaler decreases bronchoconstriction. Use a spacer. Adverse effect, oral candidiasis. Cefazolin IV. If patient is experiencing anaphylaxis effects, give epi. Shock is increased heart rate and decreased blood pressure. Combined with gentamicin can damage renal function and nephrotoxicity. Ciprofloxacin. Side effects is tendon rupture, tendon pain or swelling. Educate patient to increase fluids to 2 to 3 liters daily. Take antacid 2 hours before or 6 hours after ciprofloxacin. Milk will decrease the absorption of ciprofloxacin. Gentamicin. Adverse effects. Inflammation of liver and spleen. It's ototoxic. Methylprednisolone. It's for multiple sclerosis. It's a steroid. Increases blood sugar. Avoid people with known infections and no grapefruit juice. Prednisone. It's a steroid. Refrain from sports. Bone density scans to monitor for osteoporosis. Zolpidem. Short-term treatment of insomnia. Adverse effects is loss of memory, muscle pain, stiffness, double vision, and dizzy. Temazepam is insomnia. Limit use to 7 to 10 days. Take at bedtime. Withdraw medication gradually to avoid withdrawal syndrome. Ethinyl estradiol. This is the birth control patch. Educate patient to fold the sticky sides of old patch together before disposing. Apply patch 1 time a week for 3 weeks, then go without a patch for 1 week to promote menstruation. Patient should apply patch within 7 days of menses to prevent ovulation. Ferrous sulfate, vitamin C source to increase absorption. Educate patient to take antacids 2 hours after and do not take with milk. Carbamazepine is for seizures. Monitor white blood cells for leukopenia, anemia, and signs of infection. Can cause elevation in urine glucose levels and educate patient to use alternative birth control methods. Clozapine, it's for schizophrenia. Monitor white blood cells for agranulocytosis and cholesterol. Notify doctor of a fever, high risk of weight gain, dyslipidemia, and diabetes. Flufenazine, stop medication, apply cooling blankets, administer dantrolene and bromocriptine to relax muscles if experience adverse effects. Lithium, do not use with ibuprofen and NSAIDs. You can use aspirin and Sildac. Cromulin sodium, exercise-induced asthma, dilates bronchioles. Use 10 to 15 minutes prior to exercise. Beclomethasone, it's a LABA, glucocorticoid inhalant. Should be administered on a fixed schedule. Rinse mouth after using. Increase intake of calcium and vitamin D to minimize bone loss. Take albuterol 5 minutes before to enhance absorption. Betamethasone. This is a preterm labor glucocorticoid. It stimulates surfactant production. Budesonide, it's a long-term inhalant treatment, administered 2 times a day and not prior to exercise. Tiotropium, anticholinergic, decreases mucus production. Digoxin, this is for heart failure. Monitor for toxicity. This is yellow-tinged vision, nausea, and cardiac dysrhythmias. Taking high-ceiling diuretics predisposes to digoxin toxicity. The therapeutic level is 0.8 to 2.0, and for potassium levels less than 3.5, give potassium by mouth or IV. Do not give potassium if over 5 or an AV block is present. Digoxin Immune Fab is the digoxin toxicity antidote. Normal sinus rhythm indicates therapeutic response. Methadone is for heroin toxicity, but not given in an emergency. Atorvastatin is for hyperlipidemia. The adverse effects is rhabdomyolysis. This is muscle weakness or pain, and monitor creatinine kinase levels. Lab indicating effectiveness would be an LDL of 120. Simvastatin is for cholesterol. Report muscle pain, avoid grapefruit juice, and it's a lifelong therapy. Propranolol is hypertension. It's a beta blocker. It blocks beta 2 receptors in the lungs. Metoprolol is monitor the apical pulse before administering. If less than 60, hold it. The adverse effect is life-threatening bradycardia, and weigh daily to monitor for heart failure. Neostigmine, this is for myasthenia gravis. The adverse effect is miosis, which is pupil constriction, and increased salivation. Atropine, this is for cholinergic crisis. This is a cholinergic crisis medication for patients with myasthenia gravis. It has anticholinergic, and the contraindication is glaucoma. Filagastrum, this is chemotherapy-induced neutropenia, stimulates bone marrow to produce neutrophils. Phenytoin, seizures. Adverse effect is hypotension. Educate patient to take antacids 2 hours before or after. Oral transmucosal fentanyl lozenge on a stick. You place the stick between the cheek and lower gum, periodically move it. The effects begin within 10 to 15 minutes, and store partially used or unused sticks in a container. Fentanyl patches. Take stool softener daily. Morphine. Monitor respiratory rate. MAOI, avoid tyramines and can cause a hypertensive crisis. Insulin care, inject air into NPH vial. Expel air bubbles in the syringe. Fastest absorption is abdominal. Slowest is thigh. Store unopened bottles in the fridge. Once opened, bottles can remain at room temperature for up to 1 month. Mix insulin by rolling in palm of hand. NPH is cloudy and long. Regular is clear and short. Insulin glargine. Do not mix with any other type of insulin in same syringe. Docusate sodium, surfactant that softens stool. Glycerin suppositories, osmotic laxative, indication of oliguria, which is fluid volume deficit. Methyl cellulose, this is a bulk forming laxative. Biscodoil, this is a stimulant laxative. Baclofen decreases muscle spasticity. Cyclobenzaprine, this is a muscle relaxer. Taper medication before discontinuing. Aspirin, the adverse effects is hyperventilation, leading to respiratory alkalosis and swollen ankles, salicism. Hydrochlorothiazide, this is heart failure. Adverse effect is orthostatic hypotension, blurred vision, xanthopsia, which is things appear yellow. Get up slowly, monitor for hypovolemia. Captopril is for heart failure. Sore throat is a sign of neutropenia. Affects urinary system causing dysuria. Take 1 hour before meals. Enalapril, this is for heart failure. Adverse effects is hyperkalemia, tinnitus, hypotension, and dysrhythmias. Amoxicillin, notify the pharmacist if patient is allergic to penicillin. Fluoxetine is for depression. Avoid St. John's wort. Bupropion, this is an atypical antidepressant for patient trying to quit smoking and can also cause tremors. Adverse effect is changes in vision, hearing, and bradykinesia. Do not drink beverage while sucking on lozenge. Amitriptyline is for depression. The anticholinergic effects is urinary retention, blurred vision, and dilated pupils. Mirtazapine is for depression, and it can cause an increased appetite. Haloperidol adverse effects is EPS and increased interocular pressure. Atropine eye drops. It's contraindicated for patients with glaucoma, and the expected findings is blurred vision, photosensitivity, and reduced accommodation. Furosemide is patient teaching. Dangle legs at side of bed before standing. Take the second dose by 2 p.m. to prevent nocturia. Take with food or milk. And if weight gain, determine med adherence. Famotidine is for peptic ulcer disease. Patient teaching is take on a continuous basis for prescribed time. Smoking decreases effectiveness by exacerbating ulcer manifestations, and it's hepatotoxic. Warfarin is for DVTs. Monitor INR daily. Avoid naproxen. Avoid eating large amounts of broccoli and cabbage. The antidote is vitamin K. Heparin. The adverse effect is bleeding. The antidote is protamine sulfate. Enoxaparin is hemorrhage. Monitor vital signs and platelet count. Diltiazem. Adverse effect is shortness of breath. Educate patient to get up slowly and no grapefruit juice. Monitor blood pressure and heart rate. Notify doctor if pulse is less than 50 and blood pressure is less than 90. Diazepam. Toxicity is respiratory depression and hypotension. Give flumazenil. Measure capnography level, this is respiratory status, until vitals return to baseline. Given to patients with alcohol toxicity to prevent withdrawal and seizures. Chlorodiazepoxide is for acute alcohol withdrawal. It prevents delirium tremens. Doxycycline is teratogenic. It causes staining on the infant's teeth. Ceftazidime can cause thrombocytopenia and elevated liver function tests, excreted by renal system. Creatinine levels above 1.3 indicate kidney disorder. Reduce the dose. Epoetin alpha is for anemia. Hypertension is secondary to elevations in hematocrit levels. Nitroglycerin. Apply to hairless area of skin. Do not use sildenafil. It can lead to severe hypotension. Rotate patch location daily. Remove patch at night to be medication-free for 10 to 12 hours. Sublingual can be stored at room temperature in original bottle. Isosorbide is for angina. Withhold medication if systolic blood pressure is below expected reference range. Sumatriptan is anti-migraine. The adverse effects is chest pressure, heavy arms, and tight chest. Ergotamine is take 1 tablet immediately after onset of headache. The max of 3 tablets in 24 hours. The adverse effect is muscle pain. Isotretinoin is for severe acne. A pregnancy test is mandatory before initial prescription and before refills. Clindamycin, the adverse effects is watery diarrhea leading to C. diff, weight loss, and it's ototoxic. Trimethoprim and sulfamethoxazole is increased fluid intake to 24 milliliters daily. Notify doctor if rash develops. This is Stevens-Johnson syndrome. Oxytocin IV is for late decelerations. Turn the client in side-lying position. Increase maintenance IV infusion to maintain adequate blood flow and placental perfusion. Rifampin and isoniazid. These are TB medications. Isoniazid is hepatotoxic, which causes malaise, and rifampin has a red and yellow tinge in your urine. Verapamil is adverse effects is CHF, hypotension, AV block, bradycardia, hepatotoxicity, and dizziness. Acetylzolmide is for chronic open-angle glaucoma. Report tingling in fingers, polyuria, and weight loss. Guaifenesin is Mucinex. Drowsiness is expected. Avoid driving. Ketorolac is take with food. Acetylcysteine is for acetaminophen toxicity. Benztropine is for Parkinsonian adverse effects of antipsychotic meds. It's an anticholinergic. Folic acid, take 400 micrograms daily in addition to food before becoming pregnant. Metoclopramide prevents nausea. Donepezil is Alzheimer's disease. Report dyspnea immediately. Mannitol is an osmotic diuretic. The adverse effect is heart failure and pulmonary edema. Allopurinol is for gout. Drink 2 liters of water daily to prevent renal stones. Sucralfate is for peptic ulcer disease. It coats the stomach lining. It's a gel-like substance. Dantrolene IV bolus is for malignant hyperthermia. Give rapidly through a 3-way stopcock, reconstituted at room temp. protect from life, and use reconstituted medication within 6 hours. Tamoxifen, the adverse effect is hot flashes. Resdronate is for osteoporosis. Educate patient to take with a full glass of water in the morning before rising. Take an antacid 2 hours after and sit up for at least 30 minutes after taking. Hypomagnesemia is for long-term PPI therapy. Obtain baseline magnesium level and monitor throughout therapy. Oxybutynin, the complications are anticholinergic effects, anhidrosis, increased fiber, drink 2 to 3 liters of water daily. Dopamine effectiveness is renal blood vessel dilation, increased heart rate, and increased myocardial contractility. Fludrocortisone adverse effect is hypokalemia. Telavancin, check for pruritus. Gabapentin therapeutic effects is reduced cramping, aching, and burning neuropathic pain. Imipenem is for bacterial infection. The adverse effects is seizures. Estradiol cream for vaginal atrophy has fewer systemic effects than oral estrogen. Clopidogrel inhibits platelet aggregation. An adverse effect is bleeding. Black cohosh is an herb that's used to treat menopausal symptoms such as hot flashes, vaginal dryness, irritability, and sleep disturbance. Antitussives suppress the cough reflex. If the creatinine clearance minimum is below the expected reference range of 87, this indicates moderate renal impairment. A patient must sign an agreement with the provider before beginning allosterone for IBSD because it has potentially fatal adverse effects associated with constipation and bowel obstruction. Levothyroxine can be crushed because it's not extended release, sublingual, or enteric coated. If it's crushed, the medication should be mixed with 5 to 10 milliliters of water. Dry mouth is a common adverse effect of tiotropium. Monitor for peptic ulcers when taking glucocorticoids. Take hydrochlorothiazide in the morning. You should take isoniazid on an empty stomach. Raloxifene contraindications is DVT. Hypotension is an adverse effect of spinal anesthesia. Epoetin alpha's adverse effect is hypertension. Unstable angina is prescribed nitroglycerin. Flu vaccine allergy is to chicken eggs. Subcutaneous epinephrine adverse effect is tachycardia. Verapamil is used to treat high blood pressure and angina. Rifampin adverse effect is red-tinged urine. Vitamin K deficiency equals excessive bruising. Prednisone adverse effect is gastric ulceration. Isoniazid, take on an empty stomach. Furosemide, notify provider if tinnitus occurs. Amitriptyline, take at bedtime and orthostatic hypotension. Methotrexate, adverse effect is toxicity with penicillin. Ferrous sulfate, rinse mouth out, it causes teeth staining, take on an empty stomach. Mannitol is an osmotic diuretic, increased urine output. Nicotine gum, chew slowly and intermittently over 30 minutes. Lovastatin, take with evening meal by mouth. Desmopressin, treats diabetes insipidus. Alteplase administration, give omeprazole to prevent GI bleed. Penicillin G prevents endocarditis. Epoetin alpha adverse effect is hypertension.